Jones, good afternoon. How are you? I'm Andrew. I'm going to be your nurse today. I was told that you're having a little bit of trouble breathing. Is that correct? Okay. Let's see what we can do about that. So for starters, I'm going to raise my bed. I'm going to raise the head of the bed here for you, Mrs. Jones. Take a little bit of pressure off there. It'll help you breathe a little bit better. I am going to raise the bed into a semi-Fowler's position. Mrs. Jones, I'm just going to do a quick respiratory assessment here. See if we can help you breathe a little bit better. So upon entering into the room, I'm going to take a look if there's any obvious signs respiratory distress, looking at the skin to see if it's pale, any cyanosis, so on and so forth. I'm then going to just take a quick look at the skin, touch. We're going to see if there's any tenting here. If it's cool to the touch, if it's warm to the touch. I will also do a cap refill. I want to see about the use of any accessory muscles or chest rise and fall. Ms. Jones, if you could just take a deep breath in for me and out. Excellent. I am just going to listen to your lung sounds here. And just take a deep breath in for me. And again. One more time. And again. So in the Z pattern on the front, I'm going to hit all four quadrants. Ms. Jones, if you could just sit forward for me. And deep breath. Deep breath. Excellent. So you do seem to have a little bit of trouble breathing, so I am going to put you on a nasal cannula. So at first, when applying the nasal cannula, I'm just going to make sure we have the right size. It's an adult, it's a pediatric, it's an infant, this is an adult. So I will take the end of the hose, I'm going to go ahead and hook it into the wall first, and I'm going to turn this on to 2 liters. And before inserting the nasal cannula, they do kind of curve up and to the back and then down. So you just want to make sure that those will be pointed down into the nose and not reverse up. I'm just going to check the mucous membranes briefly. Check the mouth, tongue, nasal area. And you will start by putting those 2 prongs into the nasal flares first. And then we're going to go up over the ears. Pardon me. And then we're just going to adjust the bottom here. You want to make sure you can still fit 2 fingers in there so it's not too tight. This can also be applied up over the head. If it doesn't want to stay there. Once again, inserting the nasal area first, and then up over the back. Now on periodic checks throughout my shift, when I come back in, I'm going to check for any skin breakdown, any place that the cannula might be, into the nasal area. Once again, rechecking mucous membranes, making sure that everything seems to be in good condition. Ms. Jones, is anything bothering you there with the nasal cannula? If they do have some issues or it's rubbing too much, we can pad the hose on the cheeks, or if it's down under, we can pad under the neck. and then just throughout the shift, just maintaining it, making sure that our O2 is looking good, staying there, 95 or above, and then obviously we can adjust the oxygen as needed. Excellent. Thank you.